there. I am Allison Wollen. I am the SVP of Human Resources / CHRO for Mohawk Valley Health System in Utica, New York. So my recent workforce challenge, and I have to imagine it's very similar for anyone that's in my role right now in healthcare, is trying to, there's just a staffing shortage, a clinical staffing shortage. There's lots of opportunities now for clinical workers to become travelers, contract staff, so they're not associated with one particular organization. They can go and make more money traveling every 13 weeks to different organizations. They don't even have to travel away from home because they can go an hour in any direction from Utica, Syracuse, Albany, Cooperstown, and work at one of those hospitals as a traveler. Also, COVID, I think, caused a big exodus from healthcare. So many workers, not just clinical workers, decided that they wanted to leave healthcare after they experienced all the chaos and just stress of COVID. So I think that trying to find qualified candidates to fill positions is very difficult. Also, the workforce now is looking for, especially the Gen Zs, are looking for a lot of flexibility in their work environment. So they want to be able to pick the days they work, the shifts they work. Obviously, hospitals are 24/7, so we need people to be able to work weekends. That's not the most preferred shift for many people. And also when you're a nurse, you can't do a lot of nursing jobs virtually, or clinical jobs, physical therapists, lab tech. So we can offer as much flexibility as possible, but it's very hard to offer remote work to a lot of those direct patient care positions. So that has been very challenging, trying to fill some of those open positions and attract staff to come and work in healthcare. Well, I think one of the most recent things, and it's not something that we've done per se, but we're opening a brand new, almost 400-bed hospital in downtown Utica. It's a state-of-the-art, everything is state-of-the-art, the equipment, the facility. We're opening that on October 29th of this year. And so our staff are very, very excited to move to this hospital. It's only one of 3 new hospitals built in New York State in the last 30 years. So on October 29th, we will be the newest hospital in the world. So that is very appealing. It's helped us recruit many physicians, providers, and clinical staff, because people, and you can see it in my background, that is the new hospital that people will be moving into. And then we're always looking at ways to address the changing workforce demands. So we have created a lot more flexibility with our schedules so that staff that are feeling burnt out can, if they want, they can pick schedules that they have a week on and a week off, or they can have 2 weeks on, 2 weeks off. We do 7 on, 7 off, where people can work for 7 days, have 7 days off. Also, we have a lot of self-scheduling where people can help choose their own schedules, so it works with their family lifestyle and the times that they want to work. We're also advocating right now, we're doing a revamp of our benefits, so we will be adding more PTO time, so people will actually have more days off. Most of our nursing positions now are 3 12-hour shifts, which is the most preferred shift for a lot of our clinical workers. And so they work 3 12-hour shifts, usually not in a row, but then they have 4 days off a week. So you work 3 days, you have 4 days off, but you get paid for a full-time job. The other thing is we just created new behavior standards at the hospital, but leadership didn't create the standards. We went to our staff and asked them, what's important? What's the most important thing you want to see from your peers when they're at work? And so they created these new behavior standards, which are safety, teamwork, accountability, respect, and kindness. And so we've been doing all kinds of advertising and events around kindness, and that really does seem to help our staff with some of the burnout issues. Well, HR always needs to be nimble, and we need to have a good sense of what's going on in the work environment and what our employees are saying to us. So again, as I've said, we need more flexibility. That's what this new generation wants, is more flexibility. So we need to do that. We also need to be thinking outside of the box. And so from a healthcare perspective, one of the things that myself and several of my colleagues are doing is we're looking at international workforce, which we haven't had to do in a long time. So we are bringing in 30 to 40 nurses who have been trained in the Philippines, some of them in India, and we're trying to create communities, pockets of communities here in our areas, so that when we bring in these clinical workers internationally, they have a friendly and a nice community to go to. So things like churches, things like community events. So I think that's something that HR professionals need to be thinking about. Certainly fiscal responsibility. Healthcare is a business. We need to have an operating margin. So looking at ways to curtail labor expenses, looking at ways to do work more efficiently. If we can automate things, we need to be looking at that. And so we definitely need to utilize technology and the advancement in technology and try to automate as much as we can.